Hey there! For today's video, we're doing a very basic tutorial over massage therapy. So if you'd like to provide some massage for your loved ones at home, this might get you started in the right direction. This isn't how I would teach massage in a formal setting, but I really like some of the lay terms that we use in this. And again, it just might get you on the right foot to get started to helping somebody at home. You'll see that I'm wearing gloves in this video. That was requested by the client. It's not something that I normally do. Gloves do have their place in massage. We'll go over that in a future video, but I just want you to know it's not something that's normally involved. I hope you get a lot out of today's video, and I hope to see you in the next one. Have a great day, everybody.
So another good technique is what's called ℎ𝑖𝑛𝑔. And basically all you're doing is you're just gripping the muscle, kind of like with flat hands right here. And you just want to slightly pick up that muscle, and almost like you're milking it, almost like you're milking an udder. Right? And that's all we're doing to the muscle here. When you get really good at doing one side, the biceps, you can even do both sides. So we can get a handful of the bicep, a handful of the tricep. We can just kind of do a milking motion right there. Works really well up on the shoulder, the deltoid muscle right here. Again, you're just kind of picking it up. All your contraction, all the movement is a pulling away from the bone. And then when you go back to the bone, you release it. Now again, because we're got fully clothed and we're not using any oils or lotions, we're really going to keep it to these types of techniques, these kind of gripping techniques and vibration techniques. There are times we can even do some percussive techniques, but we don't usually use that too much with Mary. Some people will work the entire limb with this ℎ𝑖𝑛𝑔 technique and then go back and do vibration. That's normally my favorite. But some people will work from shoulder to elbow and then give a little shake. Just some gentle movement. Maybe you find a real tight spot and you just want to get in there and grip it. This is what we call a compression. It's got a lot of different forms to it, right? You might use a compression with your whole palm, but you can also use it with your fingertips. So kind of up here in the forearm, I noticed that she's got some a tight area that feels a little bit stubborn, and we're not necessarily trying to break up every tight area that can be a little taxing on the body, but I might get in here and just compress, let the body accept that we're doing some body work. And then I can go back to doing more of my movements here. Another wonderful technique that we can do is we can grab around a limb and then twist in opposite ways with both of our hands, right? So I might get around the arm right here. And this is great for the fascia. This is great for getting the fascia, the connective tissue to just release. Almost like you're wringing out a towel, right? Just do that around the arm. A lot of the times you can actually feel the tissue give way, and that's when you know to move on to the next part. If you aren't as attuned with your tools yet, with your hands, you can watch the breathing. You might actually notice that there's a nice deep breath whenever you get that nice release there. It might be just a slightly different type of breath from what one normally exhibits. We just work down into the hand right here. All I'm doing here is I'm just spreading everything apart, using my thumbs to press in. My fingers kind of peel away with the palm right here. Again, this is another technique that you can put a lot of movement into, or if you feel like particularly at the palm, at the base of the palm, wrist right here, or it can get really gunked up. Maybe you just want to get in there and just hang out for a little bit. And here, I'm not necessarily pushing with the tips of my thumbs, but I'm pushing more with this fatty pad right here, this thenar eminence, kind of pushing in and pulling away. Then maybe even I want to get in there with my thumb and index finger in between each knuckle, in between each of these bones right here. Particularly nice in between the index and thumb. A little movement right there, not bad. I just like to work down each finger, almost like a little inchworm, right? Just kind of, you can either compress your way down, or you can just kind of work your finger, your index finger and thumb back and forth, slowly making your way to the tip of the finger there. And that feels really nice on the joints. And again, totally appropriate to get to the end and just do a slight traction. All I'm doing is just getting a nice grip around the finger and just kind of pulling away. We're not necessarily looking for a pop or anything like that. If a pop does happen, it happens. But it's not really our intention to make the fingers pop. Very nice, very nice. And again, when I'm done with the limb, I really like to just shake it out. Now with vibration like this, what you're not doing is you're not tensing your muscles up until you shake, almost like you're bouncing a basketball. That's what we more want. Is that nice, gentle movement. As I'm talking right now, you don't see me like laboring to breathe and talk at the same time, and that's how this should feel. You should just be able to just kind of shake out the limb. Gonna make me look bad on camera, huh? Is that it? I'm kidding. Let's straighten this other arm out here, then we're gonna work on... So now that we've moved back down to the legs here, we're just utilizing the same tools, same techniques. You're just dealing with a bigger limb now and bigger muscle groups. So where you might be able to grab a full chunk of the bicep, the full bicep itself, you might not have that much hand to work with when you're dealing with the legs. So you're just gonna have to work within segments, but it's essentially the same thing. We're just pulling the quads away from the bone, giving them a little bit of compression there. Maybe if you're real savvy with your technique, you can even do the hamstrings, the back of the leg, and the quads, the front of the leg, at the same time. And it's just that same milking type of technique. Just kind of moving and compressing. And again, we're just kind of thinking of the muscle as like a cow udder. It's kind of compressing, moving, releasing. Compressing, moving, releasing. Now, another technique you can do, and this falls into the non-gliding type of techniques, is we're going to take our fingertips, we're going to press it into the muscle. And in fact, what we're trying to do is you can feel the muscles separate from your rectus femoris here to your vastus muscles that are underneath it. And what you can do is you can just dig in. I guess dig is kind of an aggressive word, but you can go ahead and give some pressure and just kind of peel that muscle away. So now we're not necessarily picking it up, but we're just moving it away from the other tissues, creating a bit of a hook right here. And you can feel this separation of the muscles. You can feel the striations. You're just moving away. Now, of course, this is one side of the muscle, the other side right here, just pushing the other way. Use your thumbs for something like that. I normally recommend to stack your thumbs. Yeah.
But you don't have to keep making. And you get,
And when in doubt, you can simply take your palm, press it into the tissue, make these circles. Just make some circular movement. This is what we call either circular friction or pressing petrissage. What you also notice a lot of the time as I'm working from away from the heart and then towards the heart as best as I can. And that doesn't necessarily ring true for every technique I do, but it is preferable to try to push the blood flow back towards the heart, just to support the circulatory system. Now with the knee, I'm basically doing the same thing. A lot of these non-gliding type of frictions where I'm pushing in, just kind of influencing the tissue to somewhat lengthen here. I think it feels amazing on this patellar tendon. Got your kneecap right here, and then the tendon right under it. I think is fantastic for just kind of giving a little pressure, pushing up towards the kneecap.
and you'll get this way.
Think it feels pretty good?
I like that. There you go.
And again, when I get done with all this, just give it a little shake. I have that handy dandy vibration device which normally does all this for me. This is easy enough to do. Now again, just using the same techniques. I'm either going to pull the muscle away, like this calf muscle on the back right here. Nice big area for me to pull the muscle away from the bone and kind of milk it out. But you'll feel in the front of the shin right here, can't necessarily grab, on Mary it's pretty easy. You can grab this tibialis anterior muscle. But a lot of the times what we're going to do with that is we're just going to revert back to that circular friction with the palm. We're just going to push it into the bone. And that's all we're really doing with these types of techniques. We're either pushing into the bone or pulling away from the bone. And of course, with this type of work, no gliding with any of it. So we're not trying to slide up the leg. Kind of inching our way around.
Yeah. People don't realize how cold is. I was on one. How the hell is that mean one? That's the first one.
And much as we did with the fingers, where we gave that little bit of traction to create space in the joint, you can do that with an entire limb as well. I mean, the knee loves it. The hip is very preferable to it. Ankles, I like to protect the ankles, so I'll actually be right above as I do this, but just get a nice grip and you can kind of just give some traction, give a little pull. And as you can see, I'm not really using my arm strength, kind of locking myself in and then just leaning my whole body back. Much easier than trying to pull back with the shoulders and arms.
Oh.
Now this one might look a little different right here, but what I'm doing is I'm taking my right hand and I'm stabilizing the heel. Because your bone, or excuse me, your foot has a ton of different bones and joints in it. It's not just the one ankle joint right here, but you've got all sorts of joints that move through here, and the foot oftentimes will get stuck. So it's actually nice to just take the other hand. Take the other hand and take the foot in kind of this twisting type of motion, right? Pronation and supination. I think it's called something else with the foot here, but we're going to kind of twist it back and forth. And again, if you hear a pop, cool. It's not our intention to make anything pop. If you don't hear any pops, just as cool. And much as we did with the hand, we're going to work in between all these bones here. Just kind of pressing and moving. Yeah, get a little movement there. Once you get wrapped up with the section, you can just shake it on out. You can even do something similar with both legs together here. Just shaking back and forth. You can do this with one single leg, but I think for Mary here, because she creates so much pressure in between her legs here, it's actually going to be more beneficial to just take both at once. With everything all shaken out, we can give it some more traction. And again, an important note, I just like to make sure I'm just above this ankle joint right here. Not necessarily down here tractioning, but more up here. Not to say that the ankle can't benefit from some tractioning, I just don't like to involve it with the rest of the leg. If that were the case, I would actually go above and below and just focus my technique right at the ankle instead. Since we got this here, let's use it. Vibration is good for multiple things, multiple facets of the body. At different frequencies, you'll get different results. Anywhere from increasing muscle mass, increasing bone density, hormone production, muscle coordination. And of course, you can help sedate the nervous system and increase blood flow. I also think it feels really nice to just get these right under the feet right here. So now we're finishing off with the neck and shoulders right here. This is what you might also hear referred to as your trapezius muscle. So that does cover your neck, your shoulder, and even down your back, but we're just doing the upper part here. And we're utilizing the same tools that we've been utilizing for the rest of the body here. With the shoulders here, I'm going to pick up the muscle and milk it out, just as I have been doing. But let's say you're working with somebody who has really tight shoulder muscles and you can't peel away the tissue. Instead of picking up the muscle away from the bone, we're going to push the muscle into the bone, right? And you could do that with some fingertips, pushing into the muscle. Maybe do that with a thumb instead. Anytime you use your thumb, keep it close to your hand, by the way. Pretty nice, huh? Of course. And you can even reach up to your own shoulder right here and push into that tissue and just see how good that feels. You might feel around for a couple of knots, as we certainly get those up here. And much like we did with the quads here, where we peeled away the superficial muscle from the deeper muscles, we're kind of doing the same thing up at the traps here, where I'm pinning the trap and just kind of peeling it towards her back, peeling it away from the neck. Oh, I need to get you a little more support here. There we go. Now, as we get up into the more of the neck area here, if you're working with one hand, it might be easier to grip both sides and pull away from the bone. Again, these are the basic two movements that we're using here, is pulling away from the bone. Or, let's say I can get two hands under the neck right here. I might push those muscles back into the bone and work it like this, right? And that just feels so nice. You come across some real tough spots, particularly here on the side of the neck. What you can do is just give it some pressure, basically a fingertip compression, and just press in. There are old myths that you can pop these knots. Most knots don't pop. We don't see that with most knots. So you're not going to get a popping type of sensation or noise. What you are probably going to feel is this lump of tissue kind of melts away. You might feel it getting smaller and smaller. And I don't think it has to completely go away for you to move on. But you do want it to relax a little